Carla Rodrigues. I'm a veterinarian who specializes in rehabilitation. So they'll see the surgeons for surgery, and then we set up a consult with me post-operatively in terms of my assessment of that patient. I do talk to the surgeons as well about that case, and then they meet with me as a consult, and depending on my assessment of that patient, the client's goals and what we're looking at, we come up with a plan for rehab. You can apply rehab to almost every patient out there, not just specifically orthopedic or knee surgeries. There's neurologic patients as well, but even beyond that, there's the senior patients that we don't often think about. Arthritis itself is huge, and we often see these seniors deteriorate as they get older. So if we can not just further their life in quantity, but quality, that's huge. So a big part of what I'm trying to do is really trying to get more senior care into rehab and not just post-operative patients. I assure people that there's never a guarantee, but we certainly look for improvement. We don't look for perfect in our patients, but quality of life is our primary goal for sure. I have a veterinary technician assistant who helps me with therapies and consults. It takes a certain person to be able to get that patient to do certain things. We use laser therapy, which is great for inflammation and pain management. Therapeutic ultrasound is also very good for pain and inflammation. We have TENS therapy, underwater treadmill, which is a very big tool of ours. And we have all sorts of balance discs and balls and cavalettis, things that encourage the patient to do what we call land exercises to further strengthen and help with range of motion of the joints. If they're treat motivated, very good, because we can get them to do anything we like by treats. If they're not, they're a little more difficult, but we still have our ways, and we get them to do what we need to do. It's a process, rehab. It's never one day to another. It's always weeks to months on the condition, never mind to getting them to do things. So it's also very good structurally for them mentally, I really think. It's not just physically, especially for the young patients, because it kind of gives them sort of a structure in terms of training, because we're having them do something so specific and they get so used to that it gives them that structure on top of the physical and mental benefits. It's gaining that trust. Sometimes it takes one session, sometimes it takes 4 to 5, depending on the patient. But once you gain their trust, we know that they're feeling good and that they want to come to us. And usually that's what we tell people. For the most part, a lot of patients look forward to therapy because they feel so good afterwards. So they look for us for that help, and that's an amazing feeling as well.